If you want to create marketing for your practice that cannot be ignored by the patients you want to help, it must use this three-part equation. Now, you ask most doctors, what is marketing? They'll say it's a postcard, it's a video, it's a billboard, maybe a magazine ad, but those are just delivery mechanisms. The goal of all of your marketing is to start a conversation with a patient you can help and to create trust. Using this three-part formula will guarantee that your marketing cannot be ignored. Number one, your practice. Most doctors that I talk to are really only in business to do a couple things, and I say that as respectfully as possible. They try to advertise everything they can do, but when you look at a strict revenue standpoint, only 2, 3, 4, maybe 5 surgeries, treatments, products represent the majority of their revenue. You need to really lean in on that. So what are the things inside your practice that, count them out, that represent the majority of your revenue? There's also a very high likelihood, in my experience, talking with the doctors that I work with, that those are also the things that you enjoy doing the most. Maybe there's 3 specific surgeries that represent 80% of your revenue, and those also happen to be the 3 surgeries you enjoy doing the most. So that needs to be the definition of your practice. You're not everything for everyone. You're a very specific group of surgeries, treatments, or products to help a very specific patient, and here's all the patients that you've helped in the past that were just like the person that you're trying to market to. Number 2 is your audience. Once you have your practice, you have, let's say, your 3 surgeries, then you can get to the audience. And the audience is, who are the people that align with those specific surgeries? Now, let's just say, for complete example's sake, this was a conversation that I recently had. Let's say surgery number 1 for you is breast augmentation, a breast implant. Now, a lot of people would say, well, that's pretty specific. If I did all my marketing about that, that would be good enough. Now, it could be good enough, but I really challenge you to push yourself further to get more specific. The best marketing is specificity. The more specific you can get, the more specific you can talk to a specific person, the more compelling it'll be. So let's say it's breast augmentation, and I'm just going to be a little bit vague for this. But let's say you have 2 patients that you've recently helped. One was a 35-year-old woman that just wanted fuller, firmer breasts. And the other one was a 55-year-old woman that recently beat breast cancer, but the only way that she could beat breast cancer was by having a mastectomy, and that's what her doctor recommended. Now she's past that, thankfully, and she's in the phase now where she wants to get breast reconstruction surgery. That includes breast implants, breast augmentation. Now, I'm not a doctor. I'm just kind of anecdotally talking with some of the doctors that I've helped that help these patients. But you can see in that specific surgery, there's multiple different specific audiences inside of that. The way that you're going to talk to those people, number 3, the message is going to be completely different. The conversation you're going to have in your marketing with a 30-year-old woman, 35-year-old woman that just wants larger breasts and wants to be more confident in her body is completely different than the conversation you're going to have with someone that just beat breast cancer and had to have a mastectomy. The reason that this 3-part formula is so compelling is because you're getting multiple levels deep. The only way you can create truly emotional marketing that really resonates with someone, that really makes them think in their mind, I've never felt this way. I've never been talked to this way. This particular doctor understands me better than anybody I've ever met, is by doing this process. So your practice, what are your, I like lists, I like top 3, top 5. What are the things that you enjoy doing the most? Again, in my experience, the majority of doctors I talk with, on one hand, they can say these are the things that I enjoy the most, and if I did these for the rest of my career, I would be completely happy. Those are the most fulfilling. Then you're going to get into your audience, split that up into a couple different audiences. Again, more lists. Let's say this one surgery, who are the 5 most recent patients that I helped that I enjoyed the most? Who were they? What were they going through? What was their life? Where were they at in their life? Were they older? Were they younger? Was it something that was, these 2 examples I used, that's pretty stark. Those are 2 very different people with essentially, and you know this better than me, but essentially a very similar procedure, a surgery, the way that it's marketed. And then lastly, your message. Your message needs to be really compelling, really specific. The easiest way you can make this message as emotionally compelling and specific as possible is by using this funnel. Practice, specific, your audience, specific inside that, and your message. The thing about your message is you're having a conversation in all of your marketing, a one-on-one conversation with a patient you can help. You're not talking to everyone. You're talking to one specific person. So think of the patient. Let's just say her name is, I don't know, Sarah. That's the first name that comes up. Think of your patient, Sarah. What was the conversation? What was the journey? How did you help her? What was her state of mind? That's your messaging to all the other Sarahs that are going through that same specific thing that you can help with your specific surgery. So if you want to make marketing that is unforgettable, that people just read through and feel emotionally compelled to contact you immediately, you have to use this three-part formula. You have to have a specific surgery treatment product inside your practice, the specific audience that, you get selfish, the specific person that you enjoy helping the most. You could say, I do all my marketing to this specific avatar of patient because it's the most fulfilling to me. Let's say you're a 50-year-old woman who's a plastic surgeon that recently had a mommy makeover. Maybe your community of patients is, I want to talk to everyone who's going through what I was going through. Who are you better fit to serve than someone that's in the same position that you were in? And then lastly, your message. This gets watered down so much. And the reason marketing is forgettable and it's ignored and it doesn't generate results and it's a waste of money is because it doesn't go through this process. If you want to improve your marketing and make world-class marketing that makes your patients think, there's no one else I will even consider talking to. I have to talk to this specific doctor. I'm emotionally invested and connected with them. Your practice, your audience, your message. Use that three-part formula. I guarantee you'll love the results. The reason most doctors don't do this in their marketing is, first, I just don't think that they're aware of this. Second of all, they don't want to get too specific. They're afraid they're going to leave people out. The most important thing of your marketing is talking, like I said, to a very specific person one-on-one. The only way you can do that is by getting specific. You should want your marketing to get ignored. Having your marketing get ignored is a good thing. You're not for everyone. You're for a very specific person that you want to help. The best delivery mechanism, like I mentioned earlier, billboards, magazines, postcards, I believe it's video. I believe when you use this formula and you weave a story about your patients and how you helped your patients and how you can help the viewer because they're just like the patient that you helped on a video, it's the most emotionally compelling marketing you can do. And that's what the goal of your marketing is, to create an emotional connection with someone you can help. Having a conversation, building trust. They're going to see you, they're going to hear you. It'll be like you're talking to them one-on-one. So I believe videos using this formula are the best marketing you can do for your practice. If you need help with this, I can help you with it. Videos are my specialty. This is kind of a behind the scenes of the copywriting that I use and the formula that I use when creating these videos. I do short form videos and I do long form videos. Short form videos are going to be for social media. They're going to be quick snippets of information, usually like one or two specific symptoms. And then the long form videos are going to be the entire process. I have a lot of videos on my channel where I walk you through all of this and this entire process. So if you want help with that, would love to collaborate with you on that. And more importantly, just discuss what you're going through in your marketing right now, what your practice specific things are that you enjoy doing the most, who the specific audience is inside that, and lastly, some messages we could put together to really create an emotional connection with your patients. So call or text me when you are ready. Would love to have a conversation with you about that. Would love to collaborate on some videos. My cell phone is 310-774-7311. Look forward to talking with you and hope you found this really informative. This formula you can use in anything. Any type of marketing, you're just going to ask yourself 3 questions. What do I want to talk about in my practice? Surgery, treatment, take-home product. Who's my specific audience? Who's the specific patient that I want to talk to? And lastly, what's my message to them? The simplest way that you can break down all of this is who are the 3 patients that I enjoyed the most that really made me love this job more than any other patients I've helped. Maybe it is someone like a Sarah. Do this formula specifically to Sarah. But hope you found this video informative and look forward to talking with you.